As of April 10, 2025, the world is once again navigating a dynamic landscape of viral threats and emerging infections. From the resurgence of well-known diseases like measles and avian influenza to the persistent shadow of COVID-19 and the emergence of newer pathogens, the global health community remains on high alert. Starting with COVID-19, recent data indicates a modest uptick in global cases over the past 3 weeks. While hospitalizations and deaths remain significantly lower than during the pandemic's peak years, some countries are seeing pressure on their healthcare systems due to concurrent waves of respiratory illnesses, particularly in the Northern Hemisphere. In response, several governments have reintroduced indoor mask recommendations in high-density areas such as public transport and hospitals. Additionally, updated vaccines targeting the latest Omicron subvariants are being rolled out in Europe and parts of Asia, with early data suggesting a mild to moderate improvement in protection, particularly among the elderly and immunocompromised. In the realm of long COVID, researchers are reporting new insights into persistent inflammation markers in affected individuals. Recent clinical trials are exploring low-dose immunomodulatory treatments to reduce chronic fatigue and brain fog, two of the most commonly reported long-term symptoms. While no definitive cure has emerged, the progress in symptom management is providing hope for millions worldwide. Turning to measles, the virus is reappearing with disturbing frequency in several high-income nations. The United States has recorded over 600 confirmed cases across multiple states in the past 2 months, with clusters linked to unvaccinated communities. Similarly, Canada and Australia are experiencing their most significant outbreaks since the pre-COVID era. Public health officials largely attribute this resurgence to declining childhood vaccination rates, a trend exacerbated by vaccine misinformation and pandemic-related healthcare disruptions. The re-emergence of measles serves as a potent reminder of the fragility of herd immunity. In response, health agencies are launching aggressive outreach campaigns, school-based immunization drives, and social media efforts to counter misinformation and encourage MMR vaccine uptake. Another point of concern is H5N1 avian influenza. Historically confined to bird populations, the virus has made sporadic jumps to humans in past years, but recent events have escalated its profile. In the United States, multiple outbreaks among poultry and dairy cattle have been reported. More concerning are a handful of human cases, particularly among agricultural workers. These infections have so far been mild, but virologists warn that sustained transmission between humans, should it occur, would represent a major public health crisis. Surveillance efforts are ramping up globally, with particular focus on genetic mutations that might indicate adaptation to human hosts. In Africa, Lassa fever continues to challenge health infrastructure in West African nations. Nigeria is reporting hundreds of cases and over 100 deaths since the start of the year. The disease, spread through contact with food or items contaminated by rodent urine or feces, has high fatality rates in severe cases. The lack of reliable diagnostics and limited treatment options complicates containment efforts, and humanitarian organizations are calling for increased funding and resource support. The World Health Organization recently conducted Exercise Polaris, a comprehensive simulation involving multiple nations designed to test global pandemic response systems. The exercise evaluated communication protocols, vaccine distribution logistics, and emergency coordination strategies. The findings are expected to influence future revisions to international health regulations and inform funding priorities for pandemic preparedness. Elsewhere, dengue virus is proving a stubborn adversary. Multiple countries in Latin America and Southeast Asia are experiencing record-breaking numbers of dengue infections, with some cities declaring health emergencies due to overwhelmed hospitals. The disease, transmitted by Aedes mosquitoes, is particularly dangerous during secondary infections, which can lead to dengue hemorrhagic fever. New vaccines are undergoing evaluation, and vector control remains the primary method of prevention. Vaccine development is also seeing notable progress. Researchers have announced early-stage success in mRNA-based vaccines targeting diseases beyond COVID-19, including respiratory syncytial virus, RSV, Nipah virus, and even certain strains of Ebola. These advancements signal a promising future for rapid response vaccine platforms, especially as new pathogens emerge. Public health experts are increasingly concerned about the spread of misinformation regarding both disease severity and vaccination safety. Misinformation is not only undermining trust in health institutions but also contributing to outbreaks that would otherwise be preventable. Combating this challenge requires a multi-pronged approach: clear, consistent messaging, community engagement, and collaboration with tech platforms to reduce the spread of false information. In summary, the global viral situation as of April 10, 2025, is one of heightened awareness, emerging risks, and cautious progress. While challenges persist, the scientific and public health communities are responding with increasing coordination, innovation, and urgency. As always, staying informed, supporting evidence-based policy, and prioritizing collective action are the best tools we have in ensuring a safer future. Thank you for joining today's Global Health Briefing. Stay safe, stay curious, and stay connected to science.